Pen and needle issues can be frustrating, but they're often preventable. Let's talk about jam pens and how to fix them. The needle attachment step is crucial. Here's what you need to do. Attach the needle exactly straight. Watch the inner needle pierce the bulb at the pen's top. For Mounjaro, the bulb is red, and for Wegovy, it's yellow. Be careful not to hit the rim around the bulb with the inner needle. If you attach the needle incorrectly, here's what can happen. The inner needle might not pierce the bulb. The needle will look attached, but the medication won't be able to flow. If you press the plunger too hard in this situation, the bulb could expand and burst, ruining the pen. When removing the needle, be cautious. If you catch the bulb, you could dislodge it, making the rest of the pen unusable. In order to avoid these issues, always attach the needle straight and ensure that it pierces the bulb correctly. Don't use excessive force on the plunger if you suspect a problem. Handle the needle carefully when you're removing it. Follow the correct priming procedure for your medication. Speaking of priming, for Wegovy, prime only once. Priming more than once can waste your doses. For Mounjaro, prime before every use. An important note on proper pen usage. We're hearing about patients trying to take half doses based on advice from social media. This is not recommended and it can be dangerous. Remember, use one whole dose once a week as directed. Please don't try to double dose, skip to a higher dose, or use only half a dose. There's no accurate way to measure half a dose with these pens. The manufacturer doesn't recommend using the pens this way, and neither do we. The product is designed to last for 30 days. Using it longer isn't recommended and may affect the effectiveness of it. Always follow your GP's instructions about your health. If you have concerns about your dosage, please consult our team. We can adjust your treatment safely if needed.